This is Dr. James DeLapp with the University of Colorado School of Dental Medicine with a video snippet on impression making for dental crowns. Materials needed include regular or light body PVS, heavy body PVS, auto-mix tips for light and heavy body impression material, small tip cannula for light or medium body PVS, tray adhesive, and a custom tray from SteadyCast. Auto-mix impression guns come in two sizes. Small is for light or for medium body material. Large is used for heavy body material. And each has their own size mixing tips that are not interchangeable. Paint adhesive on the inner surface of the custom tray and on the outer borders of the tray. On the dentiform and in certain clinical situations, block out undercuts with an appropriate material. The small tip cannula of the light or medium body impression material should be placed above the crevice and injected downward to capture the margin. This is an example of injection of medium body PVS. Push the material ahead of the tip. Go slowly around the tooth. Do not drag the impression material, or remove and reintroduce the tip into the material. This technique reduces the risk of voids and impression pulls. Filling the impression tray takes more force than you might think. Fill the tray completely and then seat. The tray is held in place for 6 minutes or per manufacturer's directions. Remember, impressions taken outside the mouth take longer to set. Pressure exerted on the tray while polymerizing produces stresses or bends the material and distorts the impression. This distortion will not be evident and result in a crown that fits the die but not the tooth. After setting, remove as straight as possible. Rinse blood and saliva in a patient setting, blow dry, and inspect. This photo is an example of the impression material pulling away from the tray when it is removed from the model. It is inaccurate and the impression should be retaken. This is Dr. James DeLapp with a video snippet on impression taking for a dental crown.